sometimes maintain composure if you're nervous. Get all of your supplies together. And for the ER, all of our supplies are in the room, so it's a little different. I'm not sure on the floor, maybe they have little carts that you carry around, or you gather your supplies and you go. You want to make sure that you have everything together when you go into the room so that it doesn't look like you're confused and you don't know what you're doing. So gather everything up, lay your supplies out. You're going to wash your hands really, really well, dry them. You're going to put your gloves on. And then you want to identify your patient, identify yourself, and you're going to tell them what you're there for, okay? Sometimes they're in pain, they're not feeling well, and they don't know what you're there for. So once you go into the room, for us down in the ER, we have computers in every room so we can check our orders and print our labels and our labs. On the floors, I believe it's a little different. So you want to speak to your nurse, look in your, what's your thing?
I said BMWs.
Oh, your BMWs. You want to look at Epic and confirm your order, gather your supplies, go in, introduce yourself, talk to the patient, tell them what you're going to do. So what the recommendation is that you follow a vocal method, and in your books it is on, oh, they're not paged, numbered, okay, so it's going to be on the back of the second page. So you're going to verify your order by talking to the nurse, looking at the computer. You're going to obtain your label. You're going to check your armband with the label. Very, very important. You always use your identifiers. Make it a habit to develop good work habits. Don't take shortcuts. When you start to take shortcuts, that's when it becomes a problem for the patient. It can alter their test. It can give false data. Patients are treated for something that they may not necessarily need to be treated for. So you want to do the right thing every single time. And if you develop those habits, you will know you never go wrong. You're going to have the patient identify themselves by giving their first and last name and their date of birth, okay? For some reason they're nonverbal. If there's a family member in there with them, you verify with the family member, you verify the armband, you verify your label. You make sure the medical record numbers are the same. For us down in the ER, we have a printer in every single room, and if the previous patient had a label that was left on that printer by mistake, and now you come in there and you don't verify it, you're giving results for a patient that it's not, the test that's ordered, and they're going to get treated for something erroneously. So you're going to do the right thing every time. Don't tell the patient what their name is, ask them to tell you what their name is and their birthday. You're going to acquire your specimen, and then you're going to label it at the bedside. Never, ever lay your blood down without labeling it, okay? If something happens, you don't sit your blood down. You keep it in your hand. Don't put it down. Call for assistance if you need it, then you're going to label it. Very particular with the lab, the way the analyzers run. You have to make sure you label it properly. You can't just stick the sticker on there any way you want to. It needs to go down a certain way because of the barcode in the machine for it to know what test it's running, and to be able to result, it needs to be able to read all of the barcode. So be meticulous when you put it down, name going this way. Once you have all of your blood collected and labeled, you're also going to do your second verification. You're going to check their armband, and you're going to check their stickers. It's always better to double check to make sure that you don't make a mistake. So if you remember the acronym VOCAL, that'll help you make sure that you follow the steps in the order that you need to do it. The certain labs require certain turnaround time. If we pull a lactic acid down in the ED, we want that result immediately. It helps us identify our sepsis patients, so we want to get that to the lab right away. Some labs are within an hour, so you need to make sure that you're aware of what you're doing and how fast it needs to get there. Some lab specimens, they don't want tubed through the tube station system, so that you actually have to walk those down to the lab. You want to make sure that you let your nurse know where you're going and take it down there and drop it off at the lab so that they can get it resulted. There are other labs that have time parameters on them. So if we give a particular medicine, sometimes we need to draw labs 10 minutes before the medicine and 10 minutes after the medicine. So you have to make sure that you have all of your stuff ready, your labels for the before, the after, and that you get those down to the lab appropriately so that they can result with accurate results. So in the preoperative area, specimens are going to be, routine specimens are going to be collected. Once it's determined that the patient's leaving for surgery, they'll make sure that they have enough time to get those results back for the surgeons and the anesthesiologists to make sure that it's still safe to proceed with the procedure.